Okay, so the first thing that you want to do is make some kind of connection with the person, with the patient, however it is that you have to do that. Should have already started the first time you met them, but don't just start jumping into it and, you know, shooting things at them. So you're going to go in, you're going to say hello, of course, introduce yourself again if you need to, schmooze, whatever, and then at that point, it's like what we're here to do basically is talk about chiropractic and give you some explanation about how you get hurt and how long it takes to heal and why. So the first thing that I want you to understand is that muscle is very complex tissue in the body. It actually goes in and out like that on itself. And I keep this picture around just so you can see how complicated the tissue is. There's all kinds of different parts to it. There's fibers in the muscle, there's blood vessels and arteries and veins. The only point I'm trying to make here is it takes a long time for the body to heal. So what the body does is it makes scar tissue, because scar tissue is easy to make, but it's just kind of a clump. It doesn't have any function except holding things together. Over a period of time, it'll align in the same direction as the muscle, but it still doesn't function like the muscle. And this is a critical time, because if you have the muscle trying to work around that scar tissue that's not working, that's how you get hurt a year later, or 2 years later, or whatever. See, we can't tell. We just want to make sure that the healing process is completely finished and everything's back to normal, and that takes about 3 months. It's the research that tells us it takes 3 months. And different people heal at different rates, and we all know that, but I have to have a framework to start with. So that's the framework I start with. Now, what complicates the healing process is what chiropractors call subluxation. And that's when a bone gets out of alignment with the one above it and the one below it, and it puts pressure on the nerve. When you have pressure on this nerve, the brain can't communicate at 100% with the rest of the body, so you don't heal at 100%. And the reason that's important to the healing process is because you have sensors in all your joints. So in a dark room, or if your eyes are closed, the brain knows where all your parts are. You can find your nose, or you can find your ears, and that has to do with posture. Now, when we talk about posture in the healing process, this is a normal curve in the neck. This is just an example. This can happen anywhere in the body, okay? So when you have a normal curve like this, the weight of the head and the brain, which is about 10 pounds, it comes directly here on the bone. And that helps support some of the weight as you're bouncing around against gravity. When you start to lose the curve, now you start to put that weight right over the disc, and the disc wears out faster. Now, why does that happen? I don't know. Happens for a lot of reasons. One of the reasons that happens is because you damage the ligaments in a car accident, so it can't hold this curve together. Ligaments are like taffy. They're not like rubber bands. And when you stretch a ligament in that accident, regardless of what the actual mechanism is of the accident, it doesn't always heal right away, so you start to lose the curve. And the consequences, like I said, are the disc wears out faster. When the disc wears out faster, you have an instability in that joint. And the body's response to that is to fuse everything together. Now, this here, by the time you get to here, you're already talking about arthritis. So you have pain, you have reduced motion, you're squeezing the nerves as they're coming out through this area. Well, we want to prevent that. And to be perfectly honest, this isn't going to happen like a couple weeks from now just because you don't get treatment. But the process starts when you're in an accident if we don't do everything we can now to get you rehabilitated back to normal. The other thing that I always want to make sure that people understand is that most of my patients feel better within whatever, 2 or 3 weeks. Again, everybody responds at a different rate. But the important thing is that what we talked about, this healing process, that's still going to be going on in the body for approximately 3 months, like the research says. Let's say somebody feels good and they go out jogging and they have a heart attack. Because even though they felt good, they were still sick inside. The blood vessels were slowly narrowing, and when they needed more blood to the heart as they were running, they couldn't get it, so they had a heart attack. So what I'm emphasizing is chiropractors treat healthy people to keep them healthy. We want you to feel good, but this is a process that takes time to heal, and that's why we see you for that period of time, even if you feel good. So initially we're going to start to see either 3 or 4 times a week, and as you improve, we're going to see you less frequently, and towards the end, we'll probably see you once a week or maybe even a couple times a month, and when you're back to 100%, it's good to go.